Coronavirus, how to know new coronavirus symptom. Coronavirus symptoms are a vast array of warning signs affecting almost every part of the body. The eyes are one such body part that may be infected with one, even hypothesizing this is how the virus is spread. The number of COVID-19 symptoms have expanded and continued to increase since the outbreak of the deadly virus over 11 months ago. While the bid to contain the spread of the virus continues to rage on, new and unusual symptoms have come to the surface and wreak havoc in the public domain. Although fever, fatigue and dry cough are some of the most predominant signs of SARS-CoV-2, a rare and strange symptom has been established amongst COVID-19 patients in the recent past, which causes infection inside the mouth. 1. COVID tongue has been identified as a new coronavirus symptom. What is this new and rare symptom of COVID-19? One of the unusual warning signs of COVID-19 may be developing in the mouth. He claims to be seeing an increase in the number of COVID patients suffering with uncomfortable symptoms in their mouth, such as coated tongue or COVID tongue, as he calls it. Apart from that, some claims observing increasing numbers of COVID tongues and strange mouth ulcers in COVID-19 patients. An image of a patient with COVID tongue, showing white patches all over the tongue. COVID tongue can cause patches and ulcers all across your mouth, though the tongue gets back to normal in a week's time. But if you notice patches on your tongue, you must consult your doctor and get yourself tested. COVID tongue can cause serious infection inside the mouth and also form patches all over the tongue. This may seem alarming initially. It's a harmless condition, which will resolve itself in a few days or weeks. If in case you develop COVID tongue along with other signs of coronavirus, it is important to get yourself diagnosed and confirm whether you have contracted the virus or not. In the meantime, you must self-isolate yourself and take every precautionary measures, so as to contain the spread of the virus. 2. Other symptoms of COVID-19. While new and unusual symptoms of COVID-19 continue to expand and increase, it is also important to be aware of the most common and classic symptoms. The novel coronavirus brings along wide ranges of medical conditions that can go from mild to severe symptoms. Some of the most common signs of COVID-19 are as follows: fever, dry cough, sore throat, runny and stuffy nose, chest pain and shortness of breath, fatigue, gastrointestinal infection, loss of sense of smell and taste. In case of such mouth infections accompanied by other symptoms of COVID-19, make sure to get yourself tested and treated accordingly. That said, in order to prevent such medical complications, it is important that you follow all important precautionary measures to contain the spread of the deadly virus. Ensure that you wear your masks at all times and maintain social distancing when in a public sphere. Use hand sanitizers and disinfect frequently touched surfaces, so as to prevent any unnecessary contamination. 3. Signs of COVID-19 can be seen on your nails and earlobe. With the onset of the novel coronavirus, people have experienced innumerable numbers of medical complications and health issues that have also impacted their mental well-being. From experiencing mild to severe symptoms, many have even complained of long-term effects on their health. One must stay on guard and be aware of all the signs that indicate COVID-19. It is believed that COVID-19 can also be spotted through your nails and your earlobes. This could be due to the link between the deadly virus and your blood oxygen levels. 4. COVID-19 and blood oxygen levels. The novel coronavirus has the potential to cause your blood oxygen levels to fluctuate at disturbing levels. COVID-19 enters the body through the respiratory system, causing direct injury to a person's lungs via inflammation. This can impact the efficiency of oxygen transfer into the bloodstream. Oxygen impairment can occur at different levels of COVID-19, and not simply for critically ill patients placed on ventilators. Not every COVID patient experiences low oxygen levels. Some only develop common symptoms of COVID. With the help of a pulse oximeter, one can determine the level of oxygen in one's body. 5. Can your nails and earlobe indicate whether you have COVID-19? Nails and earlobes can provide insights into your blood oxygen levels, which can also indicate whether you have COVID-19 or not. You can check your oxygen levels using a pulse oximeter, which is an easy process that shines light on your earlobes or nails, determining the range of oxygen levels in your body. It is crucial that you remove any nail varnish, dirt or artificial nails while using the oximeter, as it can disrupt the process. 6. Common signs you have COVID-19. Since the news of the novel coronavirus broke out in the world, people have been experiencing different and varied ranges of symptoms. Although the list has continued to increase and expand, some of the most common symptoms remain to be the same. The following are some of the most classic symptoms of COVID-19. fever, dry cough, sore throat, runny and stuffy nose, chest pain and shortness of breath, fatigue, gastrointestinal infection, loss of sense of smell and taste. It is only right to seek medical attention as and when the symptoms appear. Besides, one must continue taking necessary precautionary measures. Practice social distancing, wear masks and disinfect frequently touched surfaces, as COVID-19 is an illness that can infect anyone and everyone. 7. Photophobia is a form of light sensitivity and is often linked to headaches. Sufferers experience discomfort or pain in the eyes, especially when first turning on a light. Among the lesser-known problems patients have encountered are photophobia and sore or itchy eyes. It can be quite painful, but lubricating eye drops, which can be bought over the counter, should go a long way towards easing the pain. Many people also find natural remedies such as flaxseed or omega-3 oil to be helpful. Itchy eyes can also be common among COVID patients. However, if you experience extreme redness in the eyes, it could be a sign of viral conjunctivitis, though it is rare to suffer from this with COVID-19. Most eye symptoms should clear away as the virus leaves the body, but if you usually wear contact lenses, it's worth switching to glasses until your COVID symptoms have cleared. 8. How to treat other symptoms. If you have a high temperature, it can help to get lots of rest and drink plenty of fluids. Water is best to avoid dehydration. Drink enough so your pee is light yellow and clear. The health body also says to take paracetamol or ibuprofen if you feel uncomfortable. There have been some news reports of anti-inflammatory painkillers, such as ibuprofen, making coronavirus worse. There is no clear evidence using ibuprofen to treat symptoms such as a high temperature makes coronavirus worse. Try paracetamol first if you can, as it has fewer side effects than ibuprofen and is the safer choice for most people. How to respond to symptoms. If you have any of the main symptoms of coronavirus, get a test to check if you have coronavirus as soon as possible. You and anyone you live with should stay at home and not have visitors until you get your test result. Only leave your home to have a test. Coronavirus new variant. COVID-19 new variant. The areas to avoid new variant locations. The most pressing of all was how to minimize your risk of coming into contact with the new strain. What do we know about the new variant? All viruses undergo mutations, and through selection pressure can result in different variants. The variant of SARS-CoV-2, the virus causing COVID-19, originally termed lineage B1.1.7, was detected in November 2020 and is rapidly spreading across England and other parts of the UK. The new variant transmits more easily than the previous one, but there is no evidence that it is more likely to cause severe disease or mortality. It can be passed on in households when people meet people in their home, shops or any environment with an indoor setting. The increase in cases linked to the new variant first came to light in late November when Public Health England was investigating why infection rates in Kent were not falling despite national restrictions. Then discovered a cluster linked to this variant spreading rapidly into London and Essex. The UK coronavirus variant has been identified in 45 countries so far, with experts warning that more countries could report a steep increase in cases in the coming weeks. Concerns have been raised over whether the transmissible variant will evade the new vaccines, that the B1.1.7 variant currently sweeping the UK will not evade immune responses generated by vaccines or a previous COVID infection. The antibodies collected from former patients very rarely targeted parts of the virus that were mutated in the new variant. Their work suggests only 0.5% of individuals are at risk of having reduced protection against the variant, named B1.1.7. The new variant is unlikely to escape recognition by antibodies generated by prior infection with older versions of the virus or the vaccines. With the release of the vaccines, which is available in some developing countries, such USA, Europe, Middle East and some parts of Southeast Asia. In spite of the first dose of vaccines, more and more symptoms are being discovered. Make sure to take extra care always, and follow the precautionary measure as advised by the authorities and the World Health Organization. Keep on tuning to my channel for more videos. Please like, share and subscribe and put your comment below. Thanks for watching. See you on my next video. Ma salama.